Okay, so now we're going to do circulation below the diaphragm. Okay? So we're going to start with the abdomen and then we'll do the leg. Won't take that long to really understand this stuff. Last time we talked about an introduction or overview of things, and that took some time to get you pave the road for you a little bit. Then we talked about the circle Willis, and then we went into the chest and arm. Okay? Now we're just going to do below the diaphragm. Okay. So circulation to the abdomen. All right? Looks very busy up here. We're going to go through them all. It's not bad. Does everybody have those sheets? Do you need an extra copy? Anyone need an extra copy or two? Okay. This is where your diaphragm is. This is where the bifurcation happens when we talk about the common iliac arteries. All right? And remember, where the bifurcation is where your belly button is. It's not all the way down in your groin area or pelvic cavity. It's much higher than what you expect. Like I said, you could use the torso models over there and you could actually appreciate where the bifurcation is, which is much high. It's very high up there. It's there. It's not down here, it's up here. Okay? Keep that in mind. So you got the diaphragm to where it bifurcates. That's the abdominal aorta. And that's what we're going to talk about, the branches coming off of that. Now that looks very busy. I understand that. But we're going to make it very simple for you to understand. Okay? This looks busy too. The diaphragm to where it bifurcates. But we're going to talk about all this. It's not that bad. All right? Students usually say the circle Willis is the most painful of it all, if there was a painful thing. This one's not too bad. So the way I see this is that there's an abdominal scarecrow hung up against the pole, against your lumbar vertebrae. So think of him like this. Okay? Does that make sense? That's why I'm wearing the scarecrow today. Okay. All right. So what does he look like? He's got eyes. He's got a nose that's bent to the left. I'll explain that in a moment. He's got a mustache. He has a mouth, 2 arms, breasts, a hairy trunk, a belly button, legs, and he's a hermaphrodite because he does have a male kadinka. Okay? It's a joke, but you guys are 8:30 in the morning. I guess you're just dead. Now the way you look at him is that his pubic area is where your belly button is. Okay? Where his legs bifurcate is where your belly button is. So what does he look like? Like that. Okay? Not too bad. In fact, that is the same thing as that. In fact, if you look at it, don't you see a scarecrow there? Or a man of some sort with 2 arms and 2 legs? Okay, so you see where I'm going with this. Okay? So let's do the schematic view first, and then I'll show you how this is all put together. Okay? Now, think of him having this gigantic trash can lid, all right, like a hat that goes right across over here. That's the diaphragm, okay? And here's where his legs bifurcate. Now, this drawing up here is not drawn to scale, meaning the eyes for the scarecrow are not that big. They're much more thinner than that. But the location that you have 2, 1, 1, 2, 1, that order is still going to be the same. But it's just drawn a little bit bigger so that you could appreciate looking like a scarecrow. Does that make sense? Okay? So what you have over here is the 2 eyeballs, and they actually go up. They're called the inferior phrenic arteries. Phrenic, P-H-R, phrenic means diaphragm. You had the phrenic nerve, it gives nerve innervation to the diaphragm. Now you have the phrenic arteries. Now there are superior phrenic arteries. You don't have to worry about them in this class. It's coming of a branch and it's coming from above, but you don't have to worry about those. But these are the inferior phrenic arteries, and they go up underneath the diaphragm, and you could see them on those the models on the windowsill over there. Okay. Then you have this mess over here where the nose is. This is called the celiac trunk or the celiac artery. and it's going to branch into three things. So think of this like this. I'm the abdominal aorta, and then you have this thing that comes out, right? Comes out my nose, okay? So if you look at a side view, you have the celiac artery that comes out. It's a very short trunk, and then it branches into three things, okay? Does that make sense? So you have the celiac artery, or trunk, and that branches into three things. There's one that's going to go to the left, and that's where the scarecrow's nose is. That's going to be the left gastric artery. Then you have this mustache. One goes to the spleen, and one goes to the liver. That's the splenic artery, and that's the hepatic artery. And that's it. You're done with that. Now, there is a right gastric, which you don't have to worry about, at least for this class, but it comes off the hepatic artery, and you've got a right gastric artery that comes off of that. And then the right and left gastric, which goes to the stomach, will give blood supply to the stomach itself. Okay? Does that make sense? So again, you have the celiac artery that branches off into three things. The left gastric artery, the splenic artery, and the hepatic artery. Okay? Not too bad. Then you have the mouth, which is going to be what we call the superior mesenteric artery. If we got a superior, it's what else you got? Inferior. Good. Okay? And the inferior mesenteric is the belly button of our scarecrow. Now, in actuality, this belly button's off to the side a little bit, and that's okay. It's still coming after these two, the boobies, and these two over here. They're very small. I just drew them bigger than what they were, but these are what we call the gonadal arteries, and they go all the way down into the groin. Okay? They're very narrow. They're very thin, though. They're called the gonadal arteries, but these models, we can't tell if they're females or male, so we can also call them the testicular arteries or the ovarian arteries. They're all the same thing. The gonadal, well, they go to the gonads. What are the gonads? The ovaries and testicles. Any of that's fine on the test. Okay? So again, inferior phrenic arteries, inferior phrenic arteries, the celiac artery giving rise to three branches, the left gastric artery, the hepatic artery, and splenic artery. There's a superior mesenteric artery for the mouth. Then you got the ovarian, testicular, or gonadal arteries, very thin, they go all the way down to the groin. And then you got the inferior mesenteric artery. I'm going to show you where the superior and inferior mesenteric arteries give blood supply to in a moment. Then the rest is just gravy. You have the two legs, which are the common iliacs. You got the cadinka, which is the median sacral. You have the hairy back here, which are four pairs of lumbar arteries, give blood supply to the lumbar areas in the back over there, the muscle areas. And you have the two arms, which go out to the kidneys, and they are the renal arteries. If you want to have things coming out of his ears, which there should be, that's the adrenal arteries, all right, or suprarenal. They give blood supply to the adrenal glands, okay? That's it. That really is the arteries of the abdomen. If I go back to this picture here, there's the two inferior phrenics going up. This mess over here is a celiac artery with the three branches, the left gastric. There's the mustache, splenic artery, and hepatic artery. Okay? You also have the mouth, which is superior mesenteric. The two boobies, one here and one here. They're a little bit lopsided, but that's the way it is. But they're paired. So you have the gonadals, one going that way and one going that way. Then you have the inferior mesenteric. That's the belly button. You have the lumbar arteries, the hairy back, so to say. The two legs over here, which is the common iliac. The cadinka, which is the median sacral. And the two arms, which are going to be the renal. And there's your two suprarenal arteries too. That's it. You could go to this one too. Same thing. I mean, there's a celiac. Very short, but three branches. 1, 2, 3. Okay? Questions about that? All right? Pretty, not bad, right? Okay. Now, we have to show you where this blood supply goes to. So I'm going to give you a crash course right now on the digestive system. Okay? This is going to be the esophagus. It's a tube that goes from the oral cavity to the stomach. Okay? Then you're going to have 23 feet of small intestines. All in there. Then what's going to happen is you're going to start having the large intestines. Kind of does this, goes over the stomach, down here, kind of make a snaky snake thing. Now, a lot of students, when I do this, and now I'm erasing things like, what are you doing to me? Okay, sorry. All right, so this is what's happening here. You have to understand how the large intestines is set up. Small intestines brings its food into this part of the large intestine. Large intestine and colon, same thing. The first part it goes to is this pocket-like area, and we call that the cecum. This little wormy area here, what is that called? Appendix. Okay? That's the appendix. The duodenum is way up here, and right after the stomach. So this is the appendix. Now this is the way the food goes. It goes up the ascending colon, across the transverse colon, down the descending colon. It does this little S-shaped area. We call that the sigmoid colon. Into the rectum, and finally the poop scoop. Okay? And from the mouth to the anus, you got 40 feet. 40. Okay? Very long. Now, we have to expand, we have to explain to you where things are going, where the blood supply is coming from. So if you take this from the mouth to the anus and you stretch it all out, so that 40 feet is straight now, what you got is this. Esophagus is up here. Here's your stomach. This is all the small intestines. Here's the colon. And the poop scoop's here. So it's straight, stretched out. Right next to it, we have the aorta. Now we have blood supply coming out of the aorta to give blood supply to these organs. There's three major ones. The celiac, and that kind of makes sense where they go. Left gastric, hepatic, splenic. So the celiac gives blood supply to the stomach, to the spleen, and to the liver. Right? Now, the superior mesenteric is going to give blood supply to all the small intestines. All the small intestines, the cecum, the appendix, all the ascending colon, and the first third of the transverse colon. Superior mesenteric gives blood supply to the small intestines, the cecum, the appendix, the ascending colon, and the first third of the transverse colon. The inferior mesenteric artery gives blood supply to the rest of the colon, including the rectum. And there's branches that go into the pelvic cavity, which we won't go into. Okay? Questions on that? If a gastroenterologist is dealing with a patient that has abdominal pain, and he's thinking there's a blood clot someplace that's causing that person to have pain. He does a colonoscopy. He's going to put a tube going in here into the sigmoid colon, and he's looking around for any kind of compromise, any kind of lesions, dead tissue, to show if there's any kind of blood clot there. Go in here, everything looks fine, looks fine, looks fine, looks fine, looks fine. Starting about a third in, he or she starts seeing dead tissue. And it's all dead over here. He knows for a fact, or she knows for a fact, that it's the superior mesenteric artery that has a clot in it. See how you're going to use this? I have a blood clot to the celiac artery. Which of the following organs is not compromised? Listen to the choices, and then I'll ask you. The celiac artery has a blood clot to it. Which organ is not compromised? The stomach, the kidney, the liver, the spleen, all are compromised. Kidney. Do you understand how, at least I test questions, how you're going to be dealing with this? How to apply it? Questions on that? Okay. Now, just a few other schematic drawings. All right, this looks busy, but let me just show you. Here's the scarecrow's face. You see his two eyes, his nose, and his mouth is a superior mesenteric. So it's going to give blood supply to the small intestines and the proximal colon, right? The first part of the colon, which is going to be the cecum, the appendix, the ascending colon, and the first third of the transverse colon. Okay? If you look at, this is two pictures. So there's a picture here and there's a picture here. Here is his two eyes, his nose, his mouth, but we're cutting off the mouth. We're not really focusing on the superior mesenteric. But you are looking at this one with the inferior mesenteric. Gives blood supply to the rest of the transverse colon, to the descending colon, to the sigmoid colon, to the rectum. All right? You can see that I have watered it down for you, even in a schematic drawing like this. They have the right colic, the iliac colic. We're not going into those smaller branches. You should know at least the main branches coming off of the abdominal aorta. Okay, questions on that? This is what I drew in medical school, just to show off my feathers. All right. Again, if you look at this on your own time, okay, you'll see it's still the same. Obviously, we need to know a lot more, and then that's why I put it up here. It's not to show off my feathers. It's to show you how much I've watered it down for you guys. Some students complain that I teach it like medical school. That's bullcocky, okay? I've watered it down considerably. I want you to just know the main ones coming off the abdominal aorta, okay? You can definitely see part of the scarecrow here. There's his two eyes, there's his nose with his mustache. His two arms are over there. Here's the mouth. The boobies are over here. Here's the belly button. We zoom out a little bit. You see the scarecrow with his two legs now. All right? That's what I find students doing when they do the exams or the practical exams, or when they just study. They look for something that they're familiar with. You're familiar with the scarecrow, so work with that. Well, I know where the legs are, so they're going to the abdominal aorta. There's the abdominal aorta. There's a cadinka. Work that way. It's totally fine. Believe me, when you're dealing with memory, no one doesn't ask you how you memorize. Well, they might ask you, but whatever's in your head is in your head. If it looks like a scarecrow or a chicken, who cares? You're getting the right answers. It's not cheating. It's making you have an organized memory. Okay? Now, that's the arteries of the abdomen. But we got to talk about the veins. Now, the veins have two systems. One of them is very easy to manage, and that's this over here. And it kind of looks like Gumby, right? A guy here, you can see this with a very long head, all right? And you could deal with these, you can see where the renal arteries are, the renal veins, the common iliac veins, you got the median sacral vein, the hepatic veins are up here. But there's something that's missing out of here. You're not getting inferior and superior mesenteric veins. but we have another system, and I'll explain to you why we have this other system. The other system is called the hepatic portal venous system. So let me draw it out for you, and then I want to show you the significance of this. Okay? Okay. Here we have the spleen. Okay? Then we have a vein that comes out of the spleen. This is called, and I'm just going to, abbreviate just to speed off time, and not make it look so busy, but you would write everything out. So this is the splenic vein. Okay? Blood is coming from the spleen going back towards the heart. There's going to be another one that comes up here, and this is called the inferior mesenteric vein. Okay? The splenic vein continues until it meets up with another vein. This is called the superior mesenteric vein. When the splenic vein and the superior mesenteric vein meet, they become one. And this is called the hepatic portal, and you have to put portal here, vein. This is going to go into the liver. From the liver, you're going to have a couple of veins coming out of there. Those are called the hepatic veins. There's one here, and there's one here. Both of those will go into a massive blood vessel behind the liver that all of us know and love, that will lead to the right atrium. What is that? Inferior vena cava. I kind of look at this, the horse with the big head. Here's the horse. See him? There's the head, there's the neck, the front leg, the body, the back leg, and the bushy tail. There's the head, there's the neck, front leg, back leg, bushy tail. Once you see that, I always look for the horse's head and I can figure it all out. Leg, back leg, bushy tail. Even if I give you this picture, start off with the head, and I think you could figure out where the horse's body is. Can't help but see it. There's the head, the neck, hepatic portal vein, the front leg, superior mesenteric, the body, which is the splenic, which all the way goes to the spleen, so this is going to be your bushy tail, and the back leg here is the inferior mesenteric. All veins. Okay, questions on that? The anatomy? Now I got to show you the significance of this. Questions on this? Okay. We have intestines over here. Remember, blood flow is going this way, right? That makes sense? Let me just erase this to see it. Okay, now this is what's happening here. What kind of blood is found in veins? Not a trick question. Deoxygenated, okay? But We have food and nutrients that's in the intestines that needs to go to the liver to get detoxified and broken down further. So now we have food that needs to go from here to here. So the intestines have this little issue. How's it going to get over there? Because the veins are already already have deoxygenated blood there. So the intestines talks to the brain and says, Mr. Brain, we have to get our food and nutrients over to the liver. I see that you're having your deoxygenated blood pass through the liver to get to the heart. Is there any way that we could piggyback and just take a ride on that a little metro over there and just for a short distance and dump us off at the liver while you guys go continue upwards for the heart? Your brain says it's a wonderful idea. Your body has these conversations, okay? Your brain says that's a wonderful idea. So this is what happens. The nutrients here, after it's being broken down, when you get into the digestive system, you learn all about that. You have amino acids, you have fatty acids and stuff that are going to be going into the veins here. They're going to go a short distance and then get dumped off into the liver. Meanwhile, the deoxygenated blood is going to continue further to go into the lungs to get oxygenated and whatnot. So that's the significance of the hepatic portal system, is that there's nutrients there plus deoxygenated blood. Now, we have a problem, Houston. And they didn't think about this, the intestines didn't think about this when they did a sales pitch to the brain. But now the brain had to come up with some sort of reconstruction, okay? Look what's happening here. When nutrients come off of this, they can't get into the veins because the veins have a lot of layers there. The only way nutrients could actually get passed into the bloodstream is that there's got to be a one-layered blood vessel. We have a one-layered blood vessel. What is that called? Starts with a C, ends with apillary. Okay, good. Just say it's the morning, okay? So we have a capillary bed over here. This works out wonderful. The nutrients can get passed onto this one-layered blood vessel, the capillaries, and now they can get passed into the veins, which has many layers there. That works out fine, okay? So the capillaries will lead to the veins, go a short distance, but now it has to come off the veins and go into the liver. Guess what else we're going to have over in the liver area? Capillaries. So we have another capillary bed over here. So that there's one layer and those nutrients can come right off and go right there. So we're going capillaries to veins, veins to capillaries. Does this make sense? No, this doesn't make any sense. Capillaries to veins, that makes sense. But where have you ever seen a vein go into a capillary? This is why it's unique. It's a system that works here that you can go capillaries a short distance back to capillaries without a pump in the middle here. The physics actually works in this situation, and it allows the nutrients to get dumped off in that way. Does this make sense now? I mean, not sense, but the acceptance? All right? You have to have it this way. You can't just have the veins going here because the nutrients will stay in the bloodstream because it can't get through all those different layers in the veins. All right? So that's the significance about this that you have to put together. Questions about this? Questions? All right. The other thing I just want to also mention too that I see a lot of students getting wrong, this whole thing is the splenic vein. Not just this, not just this. It's the whole thing. The inferior mesenteric vein goes into the splenic vein. The splenic vein meets up with the superior mesenteric, and now it's the hepatic portal. All right? Blood goes this way to this way. It doesn't go this way. You don't go driving on Route 80 in the opposite direction. Blood is already going this way. So the splenic vein and the superior mesenteric vein converge and make the hepatic portal vein. Does that make sense now? Students get mixed up, especially when we do the trace question, which we'll do in a few days. Give you some examples. Okay? Questions about the hepatic portal system and its significance. That significance is important for lab and lecture. In lecture, they're not going to ask you about parts. That's what the lab is. In lecture, they do want you to understand the significance about this and the uniqueness about this. Now, we're going to see something similar but different when we deal with blood vessels in the kidney. And I'll show you that when we get there. Okay? Questions? All right. Let me do the circulation of the pelvis. There isn't much here I want you to know. Okay? We don't have good models of this. But this is what we just did. Here's the diaphragm up here. We just knocked off all the blood vessels in the abdomen, at least the arteries. Then it branches off into the two common iliacs. So we just knocked this all off. That's the scarecrow right here. Okay? But remember, we have the common iliac that branches off into two. The internal iliac and the external iliac. The internal iliac gives blood supply to the pelvic cavity and its organs in there. Okay? This is the leg, so the external iliac is going to give blood supply to the leg, which we'll do. Okay? The branches off the internal, again, I'm not going to ask you about this. Once we get a good model, then I have what I want students to know about the pelvic blood vessels. But until then, you just have to know that two things go into the pelvic cavity. The internal iliac artery goes into there, and the gonadal or ovarian or testicular arteries go into there. Okay? This is what it would look like for a female. All right? And you can see the ovarian artery coming off the abdominal. And this is for the male. Again, you can see the testicular artery giving blood supply to the testicle. Not going to ask you anything. Well, whatever's on that sheet that you're required to know. I put this up here just to be complete. Okay?